Good morning, ladies and gentlemen, and welcome to today's meeting of the Overview and Scrutiny panel, which will be broadcast live to YouTube and recorded using Magic Notes. Before we begin the substantive business of the meeting, can I ask everyone present to please introduce themselves for the purpose of the recording and so that an accurate transcript can be produced. I will start by confirming that my name is Councillor Woolard. Now, moving anti-clockwise.
Thank you. My name is Amy Brown.
My name is Helen Moore.
Councillor Delroy.
Councillor Hicks.
Councillor Murphy.
Anna Goodall.
Councillor Jan French.
Lorraine King.
My name is Teresa Mann.
My name is Katie Mills.
I'm Phil Butler.
And I'm Councillor James Carney.
Councillor Brenda Barber.
Councillor Alex Muscandlin.
Councillor Anne Hay.
My name's Lucy Foycebeard. Councillor Foycebeard.
Thank you. Members and officers are also reminded to please ensure that mobile phones are placed in silent mode and that microphones are switched off whilst not in use. We shall proceed to agenda item number 1 is apologies for absence. Member services, can you please report any apologies received?
Good morning. We have an apology from Councillor Booth.
Thank you. Agenda item number 2 is a request to approve the minutes. We are being asked to approve the public minutes from pages 3 to 8 of the public agenda pack as a correct record of the meeting which took place on the 19th of January 2026. Can I ask that any member who does not agree with the minutes to indicate that now? I see no objections to the proposal to approve the minutes as a correct record of the meeting, so they are now agreed. Agenda item 3 is to report any additional urgent items for consideration today, and I can confirm that there are none. Agenda item number 4 is to receive any declarations of interest under the local code of conduct or any interest under the code of conduct on planning matters in respect of any items to be discussed at this meeting. If you have anything to declare, please can you inform the meeting now? Councillor Carney.
Just for the clarity of the record that my full-time employment for the Cambridgeshire Fire and Rescue Service, and this relates to item number 6, Road Safety Partnership.
Thank you. Item number 5 is to receive an update on the performance of the Council's Revenues and Benefits Service, which is provided by the Anglia Revenues Partnership. Thank you for joining us today. Please go ahead and provide us with your presentation.
Thank you very much. And good morning, everyone. Thanks for having us here today. We're going to provide an overview and performance update for ARP. It should take around 30 minutes. There'll be time for questions at the end. A little bit of a running order for you today. We'll start with a brief overview of who we are at ARP for anyone who's not familiar with the partnership, a little bit about our background, and then we'll move on to performance, service updates, recent and ongoing initiatives, and a little bit about the wider collaborative work that we're doing with partners across districts and counties. So who are we? We're a true partnership. We are not a legal entity. We share resources to provide revenues and benefits services across 5 partner councils, and we span 3 counties. The main benefits of the partnership are to achieve economies of scale and make efficiencies. We are governed under a partnership agreement and an ARP joint committee. What services do we provide? We provide the core statutory revenues and benefits services. In addition to that, the core services are council tax, that's billing, collection and recovery, business rates, billing, collection and recovery, and administration of housing benefits and council tax support. We also have our own support teams. You can see them listed there. So we have our own systems team, our own finance, admin, training, etc. Also, being quite a large organisation, we're quite unique in the fact that we have managed to retain our own fraud service, and we provide an in-house enforcement service to our 5 partners and to external partners as well. And Katie will go talk a little bit more about that as we go through the presentation. A little bit of a timeline for you. The partnership first formed in 2003 between Forest Heath Council, as they were then, and Breckland. Gradually expanded. You can see Fenland joining us there in 2014 on the screen. And we became a partnership of 7 councils by 2015. Then in 2019, 4 of our partners merged into 2 to form East Suffolk and West Suffolk, meaning that although we still cover the same geographical area, we are now a partnership of 5 revenues and benefits services. So alongside the growth of ARP, we've also to continue to expand, as mentioned, with the provision of fraud enforcement services. We do that to our own partners and various external partners. So we originally set up ARP enforcement in 2015, and at the same time we formed our own fraud team, and that followed the implementation of the DWP Single Fraud Investigation Service, which saw housing benefit fraud move back into DWP. So the timeline on the screen there shows that journey, starting in 2015, and then with Norwich, South Norfolk, Broadland, gradually coming on board and expanding into a 4th county with Maldon in Essex joining us in April 2025. We're also in talks with another district regarding the provision of single person discount fraud services next year. Structure and governance. At the top there sits our joint committee. We have 1 member from each partner council. Councillor French from Fenland is a long-standing joint committee member. Then we have our Operational Improvement Board, or OIB. Again, 1 senior officer from each partner council, with Anna Goodall representing Fenland for us. And between them, they decide on our direction, our strategy, and ensure what we do links directly into each of the partners' priorities and service plans. And then myself, head of ARP, and the senior management team, which is Teresa, who is head of billing, benefits and business rates, Katie, who is head of recovery, enforcement and fraud, and Phil, who joined us this year. He is the revenues and benefits service manager for support. So before we go on to look at performance, felt it was the right time here to just mention recognition that we have had recently as award winners over the past couple of years. We were winners of the IRRV Revenues Team of the Year in 2024, IRRV Partnership of the Year in 2025, and we were also finalists for IRRV Most Improved Team of the Year in 2025 with our enforcement team as well. Alongside that, after being shortlisted in the Innovations category for the LGC Awards in 2025, we've recently, in the last couple of weeks, found out that we are finalists in the Public Partnership LGC Awards for 2026 as well. So really exciting for us. It's really important. Just getting revenues and benefits and ARP out there on a national level is an achievement in itself.
Okay, so we've included here a table taken from our ARP brochure. So this shows the true scale of our organisation when compared nationally. ARP have the 3rd largest caseload in the country, only sitting behind Leeds and Birmingham. Some further facts and figures are detailed on this slide for you. So ARP are the largest revenues partnership in the UK, and in 24-25 our overall income was over £845 million. We paid out over £160 million in assistance. So here are some statistics specifically for Finland. So in 24-25, Finland's overall income was over £102 million, with over £28 million paid out in additional assistance. Okay, so over the past 5 years, we've seen an overall increase in our workload of 63%, a 32% increase in council tax change of address notifications, and a 117% increase in council tax work processes. An increase in universal credit DWP records from 15,000 back in 2016-2017 to over 300,000 in 24-25. Hereditaments have increased across the partnership by 5% for council tax and 3% for business rates overall since 2020 to 2021. Despite this large increase in workload and due to our continued success in automation, we've been able to reduce our staff complement by 6.5%, which equates to 18 full-time equivalents. This has seen us achieve efficiencies of £700,000.
Okay, so now we're going to look at some service updates, starting with our benefits service. So the migration from legacy benefits to universal credit has continued at pace throughout the past year, and that's impacted on the volume of work that we've received, with an on average 30% higher numbers of files received from the DWP each week. The migration to universal credit has changed the housing benefit caseload, as universal credit contains a housing element. So we are now left to administer cases of customers of pensionable age and those in temporary and supported accommodation, and these are the most time-consuming and complex cases to process. We also deliver additional short-term help for those experiencing financial hardship in the form of discretionary housing payments, which help with shortfalls in housing costs. We try to maximise expenditure of the discretionary housing payment fund and have currently spent over 90% of Finland's allocation for this financial year. Changes to the administration of discretionary housing payments will be coming in from April this year, and they will be combined with the existing household support fund to form a new crisis and resilience fund. The housing payment element will continue to be administered by councils in the same way as discretionary housing payments for the next couple of years, and ARP have been liaising with the relevant county councils to ensure we can provide joined-up support to residents when delivering the Crisis and Resilience Fund. Council tax reduction claims continue to increase, as although working-age customers are migrated to universal credit for their housing costs, they still continue to receive help towards their council tax from local authorities. We try to make the application process as simple as possible, and we also contact customers where they've had changes to their universal credit entitlement and may now be eligible for council tax reduction. Okay, and then moving on to our council tax billing update. So the council tax billing team issue council tax bills and reminders, as well as awarding and reviewing discounts and exemptions and processing updates received from the Valuation Office Agency. The workload increases as the number of properties continues to rise, and in Finland, since October 2020, there's been an increase of just over 2,000 dwellings on the council tax list. To help us cope with this increase and its impact on the number of work items received, we have a keen focus on automation in the team. We also have to administer any changes in legislation. A recent example of this is the council tax premiums that may be charged in respect of long-term empty and second homes. We're also seeing an increase in customers contacting us who wrongly believe that using archaic law means that they don't have to pay council tax or that council tax is illegal. There's misleading information on the internet shared by movements such as Freemen on the Land and Peacekeepers, which incorrectly suggests that people are only bound by laws that they have consented to. We have an agreed consistent approach to deal with these types of inquiries, as agreed by our customer strategy team. And then moving on to the business rates team. So they're responsible for the billing and recovery of non-domestic rates, commonly known as business rates. They also process updates received from the Valuation Office Agency, and they take customer phone calls. As part of the government's transformation of business rates, there are significant changes coming into effect from April this year. And there's also a national revaluation being carried out by the Valuation Office Agency. And this means that all non-domestic assessments will have a new rateable value from the 1st of April. Work is ongoing within the team to prepare for these changes to business rates with additional resource in place. The changes include the removal of the retail, hospitality and leisure relief and the introduction of new business rates multipliers for retail, hospitality and leisure premises. To support ratepayers with these changes, the government has brought in new reliefs, with the most recent of these being an additional 15% relief for pubs and live music venues that was announced in January. We've updated our website to include information about all these changes and created some fact sheets to support customers and members, and we can share these after the meeting should that be helpful. Okay, and then just moving on to our current performance. So we report on key performance indicators on a monthly basis to our Operational Improvement Board and quarterly to our Joint Committee. We also provide a monthly performance update to Fenland on key areas. On this slide, there are some examples of graphs taken from our Q3 performance report. The first graph shows council tax collection for Fenland is currently 0.91% under the target, which is within the agreed 1% tolerance figure. As at the end of January, we had collected £72.1 million compared to £68.3 million at the same point last year. We're seeing a similar pattern of council tax collection across the partnership and through benchmarking with our neighbouring authorities. We continue to monitor it closely, and we've carried out some analysis which shows there are a number of factors that impact on collection. These can include how the target has been set, the move from 10 to 12 instalments, the potential impact of valuation office agency delays, the move of holiday lets from council tax to business rates, and the introduction of council tax premiums. The second graph shows business rates collection at the end of January was 1.49% ahead of the target, with £29.2 million having been collected. This is up from £26.7 million at the same time last year, and this is also a similar picture to that being reported by other authorities across the region. The third graph shows the number of days to process housing benefit claims. The figures for the number of days to process new claims and changes of circumstances were just over the tolerance of the locally set target at the end of Q3, but have improved from Q2. As previously mentioned, the housing benefit caseload has changed with the migration of working age customers to universal credit, and the cases we are left with are the most complex for customers in supported and temporary accommodation, which do require additional evidence and are therefore more time consuming to process. And to reflect this change, we are reviewing the local targets for 26-27. Fenland's housing benefit performance is ahead of the national average and we have quarterly liaison meetings with the DWP, and they're confirmed that they are happy with our performance. The last graph shows the number of days to process local council tax support, and this shows that processing times for Fenland council tax reduction claims were within the local target at the end of Q3.
Okay, so moving on to our recovery team. So the recovery team specialise in the recovery of council tax and housing benefit overpayments. The recovery of council tax follows a regimented recovery timetable which is set down in legislation. Our further recovery team are tasked with collecting council tax and business rates debt in very difficult cases. This includes the use of charging orders, bankruptcy, insolvency and forced sales. I've included the value of debt collected by this small team of 3 officers in 24-25 on the slide for you there. As outlined on the slide, also outlined on the slide, the number of cases in which final notices and summonses were issued, together with the volume of cases referred for enforcement action. The recovery team face a number of current challenges, which include the volume of calls received from customers, which is linked to that recovery cycle, and the financial impact on customers of cost of living. The team continue to explore further opportunities for automation and are involved with a number of partnership-wide projects to support vulnerability. So looking at our enforcement team, so we have our own in-house enforcement agency. We're one of only a handful of local authorities to take an in-house approach to debt collection, and we have been awarded accreditation by the Enforcement Conduct Board. Our investment in an in-house team highlights our supportive approach to our customers and our continued focus on ethical debt collection. During 24-25, ARP enforcement collected debt totalling £5.6 million, with £791,000 collected for Fenland. Outlined on the slide are the debt types collected by our enforcement team. We have a keen focus on identifying vulnerability and supporting our customers. A team of 6 compliance officers are the first point of contact for customers receiving a notice of enforcement, and we have a current team of 7 enforcement agents, with all agents qualified under the Taking Control of Goods Act. Vulnerability is currently identified and recorded, and the team will adapt and change their approach to enforcement if required. We've put in place a procedure to enable the enforcement team to make direct referrals to communities teams to help support those customers identified as vulnerable and in need of further assistance. We currently provide enforcement services for the ARP 5 partners and 3 additional partners, so Broadland, South Norfolk and Malden. We've implemented a consistent service offer for the collection of sundry debt to all of our ARP partners. Looking at fraud. So the fraud and visits team comprises of fraud investigators who investigate criminal cases, our council tax compliance officers who identify fraud and error in relation to single person discount and other discounts and exemptions, and visiting officers who identify and monitor new domestic and business addresses. We provide fraud services to all ARP partners, additional external local authority partners and housing associations. We currently investigate fraud and error across the ARP 5 authorities, in addition to Norwich, Broadland, South Norfolk and Maldon. We have a service level agreement in place with Sanctuary Housing in respect to provision of fraud investigation service, and we have a number of live investigations on behalf of other housing associations as well. Part of our role is to identify domestic and business properties not registered for council tax or business rates to raise additional income for our local authorities. ARP have also invested in an internal data matching system to assist with single person discount fraud identification and bulk empty property reviews. We've recently digitised our single person discount review work, contacting customers by email and text message where we hold their contact information. We're also close to rolling out the use of civil penalties as a preventative tool. I've also included on the slide there for you the total fraud identified in 24-25, including Fenland specific information. Although not currently at the end of this financial year, I can confirm that to date this year we've identified fraud and error amounting to over £4.4 million for the ARP 5 local authorities, with Fenland equating to nearly £590,000 of that figure. So looking at some recent successes, the ARP fraud team is a high-performing and successful team. This slide does outline some of our ongoing and recent success. We continue to work proactively with Cambridgeshire County and all Cambridgeshire districts as part of the Cambridgeshire Fraud Hub project, with Cambs County confirming their continued funding of this into 26-27. Included on the slide are details of a successful Fenland prosecution, together with a link to a press release outlining the work of the team in the Fenland area. Oh, sorry.
Thanks, Katie. Morning, everyone. Just going to move on now, the next few slides, look at some ARP initiatives. Starting off with automation. We are always striving to find ways we can be more efficient and have seen some great results for our automation projects. Every year we receive over 250,000 universal credit notifications from the DWP, and we can successfully automate 97% of those. We've made great progress with our change of address automation. This is even more important when you consider we receive over 1,500 move notifications per week. Other impressive statistics are the automation of 80% of web direct debits and 92% of online single person discounts. We've also extended automation to landlord submitted moves, adding around 1,000 additional automated forms per month into our workflow. Our success in automation frees up our officers to be able to work on those more complex cases and assist vulnerable customers. Now looking at our Contact Us form expansion. The new and improved Contact Us form is at the centre of how we want our customers to communicate with us, creating a preferred single point of contact. This slide shows the impressive rise of Contact Us usage and significant shift away from email. This has helped capture the right information up front and route inquiries more accurately and improve how quickly inquiries are handled. Contact Us forms represented 3% of online contact in April 2023. This rose to 44% during 24-25, and we have sustained this position. Over this period, we've seen a reduction in email contact from 75% down to 13%. The form improves the customer journey, simplifies how they contact us, includes an option to upload evidence, preventing the need for further requests for information being sent. Automated messaging. We continue to grow our use of automated messaging. We are using text, email and voice reminders to increase early engagement and reduce the volume of costly printed reminders. By using automated messaging ahead of sending paper reminders has resulted in increased engagement and a reduction of 40% of paper notices issued. In October, we launched a proactive council tax reduction take-up campaign Contacting customers who had received council tax reduction within the past 6 months who had lost eligibility due to changes in the Universal Credit Award. The increase in e-billing because of automated messaging has realised an annual billing saving of £81,000 on print and postage. Our in-house enforcement agency have replaced letters where possible, resulting in annual savings of £36,000 and increased customer engagement. We've also explored the use of payment links sent by text and email, allowing customers to pay directly through their banking apps, with the enforcement team reviewing this approach. Future expansion plans include the use of email, business rates reminders, as well as utilising it when collecting sundry debts. These initiatives collectively simplify the customer experience, increase digital adoption, and reduce manual processing, supporting ARP's ongoing digital-first strategy. Paperless billing totals. We've had an ongoing campaign to help customers move from paper to digital billing, improving convenience, reducing paper use, and streamlining administration. You'll see here on the slide that as at the 8th of February, nearly 26% of council taxpayers and just over 31% of business rates payers in Finland are receiving their bills electronically by email. Since October 2024, the paperless billing campaign has added over 36,000 council tax and over 5,000 business rates customers to paperless billing across the whole of ARP. That's prior to the opt-out campaign that I'll now talk about. So the opt-out campaign, as detailed in this slide, is a new opt-out e-billing campaign we've just recently undertaken in January 2026 across all partners, and that has significantly accelerated digital adoption. This has resulted in over 11,000 new paperless billing sign-ups for Finland, with a projection that over 48% of Finland council taxpayers will now receive electronic bills. Across the whole partnership, we expect to issue nearly 93,000 less annual paper bills for the current 2026-27 annual billing. E-bills save 87 pence per e-bill compared to paper. We've done some analysis, and with average billing patterns demonstrating that 3.2 bills per household per year issued, we anticipate an overall saving over 250,000 across the partnership for printing and postage costs. From the overall saving, 36,000 is attributed to Finland paperless billing. These efficiencies will be shown alongside the wider partnership savings from e-billing campaigns as an underspend against printing and postage costs in the ARP accounts. So moving forward to planned programme for e-billing. This slide outlines our forward plan to strengthen e-billing further. We are working on default enrolment for business rates and having opt-out options included across all of our online forms. We are currently reviewing our email data held in our secondary document management system to conduct new take-up campaigns, and we'll continue with wider promotion through posters, QR codes on stationery. Plans are underway for an automated messaging campaign to promote benefits e-notification take-up for customers receiving universal credit.
Thank you. So some initiatives in our fraud and compliance team. So in 2023, we reviewed the way our visiting team are working. We're monitoring the progress of new build, domestic and business premises. So we identified the challenges, and our solution was to reduce the number of physical visits required to monitor those new builds by utilising the data available to us. Welfare visits do continue as required. We wanted to increase our use of open source intelligence to gather the information required and only visit as a last resort. So the benefits we've seen are an increase in resource capacity due to reduced travel time, reduction in mileage, and the spare capacity has been used to identify new domestic and business properties, increasing income for our local authorities. We've also changed the way in which we deal with empty property reviews. Properties listed as empty on our systems are reviewed annually, and this was previously conducted by a letter of reviews being sent to every address listed as empty. So now we use data matching against credit data to take a targeted approach to reviews, targeting those properties that are most likely to be occupied. So the benefits we've seen are a high success rate. So the use of risk scoring reduced the number of reviews required by 74%, allowing us to focus on those with the most likely chance of success. Non-responders to those reviews were sent back to the visiting team, and of those visits conducted, between 50 and 60% were found to be occupied. And the number of properties requiring visits were reduced, as were the number of paper reviews, and we saw savings on postage, mileage and resource.
Thank you. So a few other ongoing initiatives that you might be interested in. Katie mentioned the civil penalties. We're also conducting customer insight surveys for our online forms. We're looking at forced sales, so where there's a charging order in place on long-standing empty properties, and this will support sort of wider policies across the councils for bringing empty properties back into use. The use of our open banking has just gone live, so customers can quickly link directly into their online banking apps to make a payment now. The use of web analytics and the use of Power BI to make our management information more interactive. A few Fenland specific projects. We're taking a collaborative approach with Fenland to try and increase direct debit take up and try and understand the challenges in that area, working closely with the CAB customer services at Fenland. We've undertaken some take up campaigns via email and social media. We're also supporting the Cambridgeshire-wide LIFT project, working with policy and practice. So we will be feeding into the county-wide data dashboards, and we'll also be utilising the dashboards ourselves to support our work on vulnerability. Just to touch on future priorities, top of the list there, providing efficient services that are accessible via a wide range of channels. We talk a lot about sort of the digital process and people going online, but we do encourage those who are able to go online to make use of faster, efficient online services such as online forms. With over 65% of moves reported online being fully automated and producing a bill within 24 hours. Pushing those who are able to go online then frees up the time to assist those who are unable to go online themselves and support vulnerable customers. Also looking at innovative opportunities to try and automate more services within smaller teams and maintaining that key focus on vulnerability throughout. Ahead of LGR, we're focusing on improving and maintaining our performance, fast-tracking key priority projects that will impact customer service and bring ongoing efficiencies.
Thank you. I just wanted to talk through some partner-wide collaboration aspects. So the slide illustrates the collaborative work that underpins our progress. These are just some of the support function groups that we have set up in the partnership. Officers from each partner council meet regularly to discuss issues. They share knowledge, they pool ideas on a particular topic. That's for the benefit of all as well as our customers. Our customer strategy group has recently collaborated and produced our customer service standard document, which sets out what customers can expect from us. We've also recently set up an economic development and business rates group ahead of the upcoming changes to business rates and the revaluation that Teresa mentioned. This is to ensure that we can support the businesses in our areas in a consistent and helpful way in the coming months. We work closely with West Suffolk ICT and system admin teams on upgrades, annual billing, digital programs and the general daily system support that is required. Just picking up on supporting vulnerability that's already been mentioned in a couple of previous slides. So ARP is focused on the use of data to identify vulnerability and improve welfare provision. New projects underway include, just mentioned, the use of the low income family tracker LIFT across Cambridgeshire. ARP will be a key data provider, and we're also working on a propensity to pay solution. We continue to help our vulnerable customers through our communities team initiatives. Each of our LAs have community advice and support teams that help residents with several issues, including finance, housing and health. We've established a referral route to access the advice and support on offer, and we continue to review this initiative, looking for areas we can expand and where additional resource can be provided, such as the recent introduction of a vulnerability and welfare officer.
Sorry, packed quite a lot into that 30 minutes. You should all have a copy of the slides, and this last one has our contacts on. So if you have any inquiries that come to you, you want to direct them across to us relating to ARP and the services that we provide, please email any of us directly. We've also put the link there for customers to our new Contact Us form that you can share with customers should they want to contact us directly. Another couple of useful links, a link to our online brochure if you want to find out a little bit more about us, and a link to paperless billing sign up. So we've been encouraging employees to sign up, ask families and friends to do the same. We've made remarkable progress this year, but the campaign does continue, so every sign up counts. And then lastly, a couple of links to both our ARP and enforcement websites for reference. Okay, so that concludes our presentation. Thank you for listening, and over to you for questions.
Thank you. This item is now open for discussion. Are there any questions or comments, please? Oh, very quiet. Councillor Miscandlin.
Thank you very much. Thank you very much for your presentation. Very, very informative. The valuation officers agency delays. I've got a constituent in my ward, one of my wards. He's been waiting 8 months for the valuation officer to actually come and value joining the two properties into one. Can you enlighten us what's being done to relieve that delay?
Thank you. Yes, the Valuation Office Agency changed its systems last year, and as a result, they've seen some really quite significant delays in processing. Unfortunately, they are a separate entity to us. They're managed by HMRC. So whilst we can try and sort of get progress and assist customers where we can in delays, and certainly anything of that sort of length of time, we could certainly look and see if we could chase it for your resident. But unfortunately, these delays do continue. We do try and support customers if they're waiting for properties to be assessed. So we can sort of set up accounts in advance of a property being banded or rated, so that customers don't get a large backdated bill in those kind of situations. But unfortunately, yes, we are seeing the delays sort of improving throughout the past couple of months.
Thank you for that. Actually, Fenland were very helpful to them because it became 10 and 12. They've lumped it into one. So Fenland were very helpful, but the valuation office, no, not helpful one little bit. So it makes your job of collecting rates on behalf of Fenland more difficult because you haven't got the right information. Thank you.
Do we have any further questions? Councillor Roy.
Thank you, Chair. I just want to go on to the recovery teams. Is there any figures or statistics or percentages of any non-recoverable cases that you may have? Do we know where that stands currently?
Thank you for your question. Of course. So within the council tax collection target, we have a bad debt provision to account for any debt that we're unlikely to collect. I can give you some specifics around collection on the fraud figures, if that would be helpful to you. So part of the Cambridgeshire Fraud Hub work means that we've identified a lot of fraud overpayments or underpayments of council tax, should I say, where customers are billed backdated and asked to repay that money. And we worked with county because they wanted some information about how recoverable that debt actually is, because if you find a fraud, sometimes you can't collect it, and it's difficult. So we looked at it, and we found that between 70 and 75% of that debt that we'd identified as fraud at the 9-month point after we'd rebilled the customer had been either collected in full or was part of an active arrangement, which we felt was quite successful, 75% of that debt. And obviously the debt that hasn't been collected at that point would go through the usual recovery cycle, move through to enforcement, potentially charge and order action if that's appropriate. Thank you.
Thank you.
Councillor Hay.
Thank you. I just wanted to ask, obviously, with collection of council tax particularly fraud and the like, a large proportion of that, if collected, goes to county council. Is county council, probably this is maybe a question for the member, is county council now making sufficient, given us sufficient money to help with this collection? Because I know at one time they weren't.
I can answer that, and yes, when I was county council, I did chase, and the leader put that in place, and I believe ARP are happy with the amount of money, and it hadn't been for county putting that money in, we just wouldn't be able to do what we've already done.
Councillor Miscandlin,
Again, yeah. The assumption from ARP that most people are online, most people are quite happy to deal with forms, QR codes, and other such mysterious things is not true. So what are you doing to alleviate that? I know quite a few people that you mention a QR code to them and their face screws up, they don't want to walk away. And I actually am one of those because I hate the things.
So our view is that if we can push as many people who are willing and able to go down the online route as possible, so that their provision of their services is automated and efficient and effective, that then frees up more time and officer time for us to concentrate and deliver the service in a variety of ways to other customers. So we still have a telephone line, we offer teleclaims, so we will call people up and fill forms in for them over the phone. We still accept contact in a variety of forms and formats, and we also still have a visiting team who will go out and visit people should they need to. So we still retain all of those wide-reaching sort of contact methods that we've always had in place. It's just that we do try to push as many people onto that more automated and more effective route as possible, but we totally understand it's not for everyone, and we still have a variety of contacts in place.
Thank you for that. One of the things that you don't do, you don't publicise what you do to the public. I'm also a town councillor. Do you produce a poster that can tell the public that we post on our notice boards outside the offices, or to the various town and parish councils that these services are available? Because I've never seen anything that's been published that enables the members of the public to get in touch with you in any way.
We did actually notice as we came in that we do have a couple of our posters in the foyer, which is signposting people to assistance with signing up for e-billing for business rates and council tax. And yes, we do. We try and get as much information as we can out there to members, member flyers. We have posters in CABs, DWP. We try and get them in all of the contact centres across our partnership as well. We also have a rolling programme of social media campaigns to sort of raise awareness of what we do, what is available, and the ways to contact us. We also feed into a lot of to all of our landlord forums within our areas and newsletters across the councils as well. So we do try and do as much as we can to sort of get the word out for what we do, what our services are, and how we can support people.
Just in addition to that, if I can just come in, the model that Finland utilise in conjunction with the partnership is that customers can contact us through our contact centre. Not all the partners operate in that way, and that way we can ensure that we can funnel those contacts if needs be. So we do promote that through our own contact centre as well, Councillor Miscandlin.
Thank you. But you're still not notifying town and parish councils. We know that we can go through Fenland, and as Fenland district councillors, because I'm also a town councillor, but there is no leaflets that come out that promote this to the public. And can I ask you, town and parish councils are just as important as the district council in getting information to the public. We actually hire out a room for free to the CAB in our offices in Whittlesea, but you're still not getting that message out. not in an effective way. And I think you need to look at doing that.
Absolutely. There's always more we can do, and take your comments on board, and that's something we can take a look at. We do create a lot of fact sheets, member leaflets. We've done one recently on the business rates changes, done one on second homes, and sort of e-billing take up. So we do prepare these things, and we do try and get it out there. If it's not reaching as far as we need it to reach, then it's something we really need to concentrate on. Thank you.
Thank you. Councillor Barber.
Thank you, Chair. Yes, thank you for the presentation. A couple of things, it went quite quickly, a couple of things that I wasn't too sure about. On slide 32, it talks about Fenland DD project. A DD to me means direct debit, but you said it was something else. Is it something else?
Thank you. Yes, no, it is a direct debit project. So we've identified that Fenland does have a lower take-up rate for direct debit payments for council tax than the other councils in the partnership. So we've done some sort of proactive work alongside our customer service teams and the COB to try and really boost that.
Okay, thank you. And on slide 35, it says you're close working with WSICT. I have no idea what that is.
It's West Suffolk IT. Different elements of the partnership provide different core services, and West Suffolk provide all of the core IT services for the partnership. So, yeah, apologies. My narrative did say West Suffolk, but yeah, the abbreviation was in the slides, so it's West Suffolk IT.
Thank you. Just one more. I see that you are dealing with 1,500 changes of addresses a week. That seems huge. It's not just Fenland, is it? Is that all 9 areas?
That's all 5 councils in a partnership.
Okay, thank you.
Councillor Roy, please.
Thank you, Chair. I just wanted to follow on from Councillor Miscandlen's point there, that there's lots of digital hubs now that are popping up everywhere, and community warm hubs. And certainly the 2 hubs that I support, we have mainly senior citizens that come along to access those digital services. More of a suggestion, really. Is it worth the ARP working with those digital hubs and warm hubs to encourage that? Because there are still a lot of people within Fenland, certainly, my ward, such as Christchurch, with a huge majority of them don't have access to internet, to try and push your message forward and get them online.
Absolutely, we would welcome that. Yes, it's something we can look into.
Thank you. Councillor Carney.
This is very much followed in a similar sort of vein to Councillor Roy and Councillor Miscandlen. You mentioned about working with vulnerable people and getting the word out there. Do you actively also work with professional agencies such as and professional charitable bodies such as P3, NHS, social prescribers, anybody like that who visit vulnerable people at home? Because it's another way that you can actually reach out and come across those people who are probably really struggling.
We have a lot of information that is available to all of our staff around sort of what is available in each of the local districts and nationally. So they're all very, very well aware of the support that is out there. What we try and do is to focus on that our communities team referrals. So we identify someone as vulnerable, we'll pass it back to the communities team at Fenland. They have those connections and they can reach out to county councils and other organisations, and they're geared up to provide that holistic support and look in all avenues of that person's lives and where they might need additional support.
Councillor Forrest-Beard, please.
Lovely, thank you. It's not a question, but it's just more, I guess, for information. One of the links on the previous slide didn't work. It was to the brochure, so if we could have access to that, that would be lovely. Thank you.
Thank you. Any further questions? Councillor Murphy.
Yeah, this is harking back to again to what Councillor Miscannon said. But one part on there, you said faster, efficient online services. But the faster and efficient online service you get, there'll be more people that won't be able to come into it, because there are people like myself who are getting on, things come up now, and I don't understand what they are at all. So I'm slipping back, and other people will slip back at the same time if you get too efficient.
Absolutely, and that's why we are very careful to try and get that balance right and have a variety of routes for people to contact us and a variety of sort of methods to use. We also doing this customer insights program where when people are using our online services, we are then sending out surveys to get their feedback, what worked well, how useful was it, how easy were the services to use. And some of the feedback from our first wave of surveys was around uploading evidence. So we've looked at trying to make that more user-friendly, and we've also produced a how-to video and put that on the website as well to support people in the areas that we know are more technical. So it is an ongoing project of ours. We're just about to do sort of the next wave of customer insights surveys to get more feedback. Exactly.
Councillor Hicks.
Do you think it'd be worth a while, you've probably got this in place anyway, to have somebody on your team specialised in helping the elderly with these online services?
We do have a team or a group of people who sort of are specifically trained to support vulnerability, the sort of vulnerability experts. And we also have a team who can assist with telephone claims, etc. So we do have sort of little cohorts who can offer that additional support. But we are looking at introducing more specific roles around sort of supporting vulnerable, particularly pensioners, vulnerability, and sort of it's a growing area, so we are introducing more roles in that area.
Councillor Roy, if you wanted to come back in.
Yeah, thank you, Chair. Just a question really about the technology. A lot of organisations are going over to app-based usage on their mobile devices now. Is that something the ARP are considering? Is that something that's going to happen in the future?
We don't have our own app. We are looking at all sort of new ideas and initiatives. We've just recently introduced sort of that link into online banking apps, which we're already seeing good success with. So yeah, it's something that is being considered and on the roadmap, but not in place yet.
Well, there seems to be no further speakers. Therefore, I would like to thank you for your attendance here today and for the information that you provided. Thank you very much indeed. We are going to have a slight change to the agenda today, in that we will now move straight to agenda item 7, and then we'll come back to agenda item 6 afterwards. Agenda item 7 is to receive an update from Public Health and Education. I would like to welcome those attending and invite them to join us, and please could you identify yourself.
Good morning, everyone. My name is John Rook. I'm the Managing Director of North Cambridgeshire and Peterborough Care Partnership. Would you like me to start, Chair?
Yes, please do.
Okay, I will intend to keep it brief, but I've got a few slides to just guide our discussion, and very much look forward to your questions. So North Cambridgeshire and Peterborough Care Partnership, just for anyone who wonders who we are a place-based partnership, place covering Peterborough, Huntingdon, and of course Finland. with a range of different local authority NHS partners and about 2,000 voluntary sector organisations that come together. And we form ourselves together into a board with representatives of all of those. The aim being to do the things we best do together as a partnership across health, local government and the voluntary community and faith sector. So that's just by way of background. So I find myself accountable to all of these various different people, but have the benefit of drawing upon the great resources and intent of these hospitals, councils and charities and all of those partners that make up our partnership across the patch. So just a quick rundown of some of the things that we deal with. So of course, we have a varied population across our patch, and it varies by household, by street, by neighbourhood, by district, and across the whole of North Cambridgeshire and Peterborough. So some of the things we look at are the public health issues that face our population, but also the variety and difference and inequity that face our local residents. And that's something that we as a partnership pay very close attention to. So it's not particularly the people who turn up to our well-established services. We as a partnership look for people who don't, people who are easy to forget in some of the things we do. So whether that's cancer screening, whether that's finding people with underlying heart disease, whether that's addressing poverty, whether that's supporting people to find work who may be suffering from ill health, we as a care partnership focus on that and use our public health expertise within the partnership drawn from our local authorities, as well as clinical and professional expertise to drive some of the things that we do. So here's just a quick summary of what we've taken on as a partnership in 25-26, coming to an end at the end of this month. So we had a focus on tackling obesity, finding people with underlying cardiovascular disease as one of the key drivers of inequity in life expectancy in our patch, working together on issues affecting health and employment, so particularly focusing on how do we drive the Work Well programme that we've piloted on behalf of Department of Work and Pensions in our particular area and done that very well. Finding and supporting people who are at risk of being homeless or are homeless to find support for various different services. Then, as I said, looking at particular areas where we have inequity of access. So cervical screening has been a big focus in the past year for us to find women who have not accessed that for whatever reason and to take services to them, as well as supporting people when they become frail or towards the end of life as well, with a pretty endless task of getting better and better at that. What we do organise ourselves into, because across a partnership of nearly 600,000 people, or indeed 3 locality areas, we divide ourselves up into 13 integrated neighbourhoods, we call them, across the patch. So in Fenland, that's Fenland, South Fenland and Wisbech, populations of around 50,000 on average, where we drop into those particular neighbourhoods to build upon the local assets and agency of those communities with our partners to try and solve issues which are pertinent and important to them. So some of the areas that are important to central Peterborough are not necessarily important to Fenland. What's important to people in St Ives in Huntingdonshire is not necessarily the priorities of people in Wisbech. So those neighbourhoods are very much at the foundation of how we find and support vulnerable people within the partnership. During this last year, because of our neighbourhood approach that we've taken over the past few years, the Secretary of State for Health named us a national pioneer in something called neighbourhood health. So this is a way in which the Department of Health and Social Care believes that we should increasingly organise ourselves into neighbourhoods of around 50,000 population to increasingly support people out of statutory sector or out of hospital environments. So what we've been particularly focused on there is frailer older people, and trying to wrap some of the disparate services that have existed and been built up over years around them. So bringing together social services, community health services, GPs, voluntary sector, to support them. And we've had one of our pilots in Wisbeach where we brought people together to say, how do we communicate better as a set of professionals? How do we do that to allow people to tell their story fewer times, to take that history from them fewer times, and to give them a more holistic offer, and to keep them safe and well and not needing to end up in the back of an ambulance if we can help it. So that's what we've been piloting. That comes to an end at the end of this month, and we've been doing that and reporting on that nationally. Just to touch specifically on Fenland, particularly this year, alongside piloting that new national approach in Wisbeach, just on the screen are some of the things that we've been focused on, dependent on what the priorities have been set by the local people and their partners in the different areas. And then examples of these include some quite specific things we'll be doing around it. Improving levels of activity, trying to improve people's healthy weight wherever possible. Also focusing on men's mental health. So particularly create an environment where we bring men together to do that through a initiative called All Right Mate. And t-shirts and jumpers are genuinely available for this, where we bring men together who may be struggling with their mental health to talk about it, to open up and create that environment, which is it's not a clinical intervention, but it's incredibly powerful and helpful based on the feedback we get from those. You can see over 2/3 of people said that they significantly improved their wellness score as a result of talking together and being together, which is tremendously powerful. Another couple of examples. Bringing fitness and activity services, something that was prioritised, particularly in the rural area. How can we bring that to people? And as well as also we have a number of people who are diagnosed with type 2 diabetes or may have levels of obesity that needs addressed, to actually bring information to them to help understand how to support and manage, and in some cases move themselves away having a diagnosis of type 2 diabetes because they've changed some of their behaviour and clinical markers positively to move away from that particular diagnosis, which has been helpful. So we're now in planning zone for 26-27. What's important in that is last year the government announced its NHS 10-year plan, and the reason why they asked us to pilot some of the neighbourhood health initiative was the government sees that neighbourhood health being the future fabric of health and care delivery. So we are well set for that because we already have our 13 integrated neighbourhoods established and operating and doing good things with and through their local community. But recognising the national strategy is to bring more services out of hospital from the NHS into those neighbourhoods to make them much more focused about identification and support of vulnerable people, whether it be adults, child, or people with particular risky behaviours. So in our planning, we've been taking some of that national policy and as a partnership of local partners. On the screen there you can see a variety of different strategies produced by our partners in local government as well as the NHS to then say, actually, how do we form our plan? So it's in development, but the sort of things we are looking at, again, driven by national and local priorities, are improving people's health and well-being. There's a bucket in there which includes, can we support people who are in ill health to get jobs and employment, work well, connecting for health, connect to work, all of those national initiatives that be with us, and inevitably will include things around children, young people not in education and training as well. Specific preventative measures is a bit of a bucket for, have we vaccinated our older people for flu and COVID? Have we immunised our children? Have we got people getting the right health checks, whether they're the NHS health check, people with learning disabilities and serious mental illness, getting those? Are we measuring our uptake of those, and again measuring that equally across our population? A massive priority, of course, from local people, up to including local government and national government, is around our access to primary care services, GPs, dentists and others. So of course that forms part of our plan and something that we will very much be held to account for across by national government as well as local partners. The other thing that is important for this national shift that's proposed from sort of statutory centralised care into neighbourhood care is, can you access good urgent care services in your neighbourhood? And increasingly, are your planned care services, so outpatients diagnostics delivered by the NHS, more accessible to people in communities rather than centralised? And one of the challenges the NHS is looking at is it spends more on outpatient follow-up appointments than it does on the entirety of general practice. And as a public accessing some of these services, you might say, actually, is that the right balance? And that's the challenge we've been given. Actually, what is the right balance? And particularly in the location of services, would you not want your specialist advice increasingly given to you in an alternative environment than a long trip to a hospital, paying the parking, often an appointment that might be running late, to be told that they haven't had your blood test back? We've all had experience of that where we think it could be done better. So that's one of the challenges for us. How do we localise some of this care? And then particularly a priority for us is people living with complex needs, people with frailty or people end of life. How do we build on the pilot we've had in Wisbech to say, actually, how do we coordinate this care across agencies better? How do we form multidisciplinary teams that carry caseloads of people that very much would benefit from the support to get better outcomes with them? Thank you, Chair.
Thank you. This item is now open for discussion. Are there any questions or comments, please? Councillor Roy.
Thank you for your presentation. That's really good. I was here at the overview and scrutiny the last time you came, and one of the questions I asked was the communication between GPs and facilities that were locally available. We've got a new CDC at Wisbech, and feedback from residents is that the uptake has been very poor. And it's still being underutilised. I think they're referring to the endoscopy unit that's gone in there. Why is it that communication hasn't been improved, and why is it that GPs are still not referring to there with a preference to send them to King's Lynn, which is the next hospital along?
Thank you. So we had the building of the CDC locally, and then there's been a further building of a CDC in King's Lynn on the site there. There's another one being built in Peterborough as well, part of a national programme. So I think as these things have been developed quite rapidly, I think the one in Wisbech has not worked as well as anyone expected. And I think some of the establishment of how that's done, I think it's operated by Cambridge University Hospitals, which doesn't necessarily have a big footprint in this patch except for the very specialist services, and that's led to lower uptake because our GPs tend to refer in traditional routes, but also that counts for some of Norfolk who could quite easily refer into that centre as well. So you're absolutely right, it's underutilised, and that's one of the challenges we've got in here is how do we drive up that utilisation, because for some tests that we might have, so spirometry for people with lung disease, you can wait 2 weeks there, whereas you may wait 6 months if you went to Peterborough, and we're not utilising that capacity properly. So it's very much on our agenda to maximise that, because there's more than enough tests to be done, and we need to use that capacity better. You're absolutely right.
Councillor Force-Beard.
Thank you. Just to go a little bit deeper on that one, it's lovely to hear that they're being built, so many are being built, and they're popping up everywhere. I'm no expert, but would it be helpful to the residents of Fenland, specifically, to equip these buildings, these healthcare, the CDC? We've got a hospital in Wisbech. The X-ray department is closed. It can't do any in-depth, any specific scans, apart from just a break for an emergency. Can we not fund these, have the up-to-date, even equipment, working equipment in those? We do struggle in Finland. There is a huge inequality for healthcare services. I enjoy hearing about preventative measures and get yourself screened, try and find, I'm not going to go into a rant, I promise you. I won't. You know, get yourself checked out. We can't get doctor's appointments. And when we do, we have to travel. When I say we, as a collective of Wiz Beach, have to travel to Kings Lynn. Time off work, bus journeys, the travel, the infrastructure. So to bring it back round to my point, is there a way, can we, the powers that be, properly fund, specifically the Wiz Beach one, properly fund these buildings? It's great, like I said, that they're all being popped up everywhere, but they're pointless, really. And then when people try to use them, they can't, so then it kind of skews the data, or people aren't using them, people aren't being referred, but they're not doing what they're meant to do. So we're kind of, it's already stacked against us in the beginning. So yeah, if you could answer that would be fantastic, but also fund them properly. Thank you, sorry.
Thank you. And unfortunately, so the location and funding of the diagnostic centres is above my pay grade. So they are set out nationally. We need to use the local ones far better and maximise those opportunities. Your particular issue about the X-ray equipment, we have applied for national capital funding to upgrade the local facilities to then make sure that they are open and available. So aware of that, the Integrated Care Board has applied for that in the last few weeks. We're hoping that will be with us by the end of March, based on how capital planning works. Got to use it all up by financial year end. We're hoping that'll be successful, and then we can upgrade those facilities to give people local access. But very much it's national policy, and we have heard it before. We have heard this national policy before about moving stuff into the community. There is a genuine push and measure on what proportion. So particularly hospitals are challenged to do 25% less outpatient activity in their hospital buildings. That means it doesn't just delete that work, that needs to go somewhere. So that should be done outreached into local facilities, or indeed as we plan and deliver new facilities, they should have outpatients and diagnostics within them, and they should be high grade facilities that don't break down.
Thank you very much. Thank you.
I've got Councillor Murphy next.
Well, I don't think I will now because Lucy's just stole my thunder. Thank you very much.
Right, we'll move on quickly then to Councillor Hay.
Thank you, Chair. I just wondered, it says North Cambridgeshire and Peterborough Care Partnership. Does that cover Chatteris? The reason I ask is within your slideshow, you mentioned type 2 diabetes, but you didn't touch on pre-diabetes, which a lot of people do fall into. I know that myself because I've been referred to something called Second Nature, and a lot of people won't realise you can either attend on a face-to-face basis or they offer a digital option, which might be a lot easier for a lot of people, whereas you just give 15 minutes of your time each day and you get tailored support.
So identification of pre-diabetes is really important. I gave one example of where we've been trying to do that is using GP data. What are the clinical markers that would suggest someone might have pre-diabetes? Because there's all the evidence in many cases you can avert that, whether that's about diet and exercise in particular, whether that's about medication, to get that earlier. So that's some of the things we would certainly do when I put that bucket of sort of preventative measures where we can identify that and support people with the right advice. In some cases it's coaching, as you describe, the better, because then people don't end up on lifelong medications. And if you avoid your type 2 diabetes, you avoid all the things that come with that, is all of the eye checks and foot checks and so on that go on with it, which are incredibly inconvenient if you can adapt and mean your clinical markers through a change in behaviour or medication. So, and that's very much the same for other cardiovascular disease as well. That's why we're trying to find a lot of people who have undiagnosed high blood pressure or high cholesterol, try and find them wherever we can, because the prevention is much better than the dealing with the after effects.
Thank you for that. Just one other thing. Can I ask that these slides be shared with us? Because obviously we haven't had time to actually read through them, and it would be interesting. Thank you.
Councillor Carney.
Thank you. Just to reiterate the point already made about the North Cambridgeshire Hospital at Wisbech and the X-ray department and everything. Now, I'm thinking sort of more generally, Doddington Hospital as well, the other hospital in Fenland. But I come across a lot of people who have got healthcare issues for various reasons, and one of the biggest barriers to them is actually transport, just actually getting to these places. Just recently had somebody been given a diagnosis and they think, great, I've now got to find a way of getting to Hinchinbrook. This is somewhere sort of in this area, the March area. I was able to sort of say about local transport, like a fact for us. But that does seem to be a bit of a running theme I've come across. So if the point could be made to bring services back to the more local hospitals, I think that would actually perhaps break down some of the barriers for people.
So one of our partners is, but two of our partners, the QE at Kings Lynn and North West Anglia as a foundation trust as well, with hospitals at Hinchinbrook, Stamford and Peterborough, as well as services at Doddington and so on. Their strategies are to move their services outside. They are looking at alternative facilities where they could do that. And some of the national plan is to build neighbourhood health centres. And I think that might be towards the end of a 10-year plan rather than now, because of the mechanism of financing and so on. But the aim is we utilise these facilities better. So that's what we're working through now, is actually what are the opportunities at North Cambs hospitals. So we've got an array of different providers providing different services on that site, but no significant sort of owner of the site. I think a bit of the same with Doddington as well. Actually, we've got a bunch of different services, but what is the plan for these, and does that solve the local access issues? Because we can put a load of stuff in Doddington, but doesn't necessarily solve the access issues for people in Wisbech or area, does it? So that's what we're working through now, is what services, particularly working with the hospitals where they are directed, encouraged, supported to move it out. What should we locate where? And some of that, and just your previous conversation, will be digital, because if that's the choice of individuals, then we offer it digitally rather than asking people to travel for appointments, which can be done and should be done digitally, or for people who don't access digital services, how do we do them face to face more locally?
Councillor Hicks.
I'd like to go back a little bit, please, if I may. What are you doing specifically to try and change the mindset of these GPs which have traditionally sent people to Peterborough or whatever for one service when it could have been done locally? To these hubs. What are you doing to change that?
So we have to work on the assumption that GPs send people for specialist investigations for a reason, based on clinical judgment. I think some of our discussion today has been about what could be accessed more locally, and some of that should be around what's provided in and around the GP practice. So can they do more in their own buildings? And that's been something, I think, particularly around the COVID period, where we started to re-centralise things back in hospital rather than have them located out. So things like minor surgery, minor ailment stuff started to drift away from those services. So I think things like intrauterine coil fitting for women moved and started being done in hospitals. Lung function tests started being done in hospitals, where previous 20 years prior to COVID, we did them in primary care. We did them in general practices. So there's something we've got to arrest and bring back. That's some of the plans we've got, is actually for the simpler tests that don't require specialist equipment or a high degree of specialist input, bring those back to local provision.
Councillor Miscanlon, please.
Thank you, Chairman. Get on to the tricky subject of actually getting an appointment at a doctor's surgery. The current system is appalling. My own local surgery, you've actually got to go and queue up at 7:30 in the morning when the surgery opens at 8 o'clock. You all pile in and try and get an appointment. You're then told, go home, and the doctor or someone will ring you later today. That is totally unacceptable. You know, I live 4 miles from my surgery. So it means if I want to go there, I've got to drive 4 miles, queue up at 7:30 in the morning and wait till 8:30 for them to open up to possibly give me an appointment, then to be told to drive 4 miles home and get it done there. One of the classical things, they sent me a letter from my surgery to go and have a blood test over the phone. When the nurse phoned me to say, you've got an appointment, say, for a blood test, she went quiet. So I asked her, well, how do you take a blood test over the phone? To which she said, with great difficulty, can you come down now? So I think something has to be done about the appointment system. And it's not just my surgery, it's all over the place.
No, that's feedback we get all the time, and we get from Healthwatch. We can't take blood over the phone, but if only we could. That would be a great revolution. More seriously, since October, the GP contract changed, so that you can contact your GP practice 24 hours a day. Not necessarily then open 24 hours a day, but you can contact 24 hours a day to request appointments. You don't just have to go through a very small funnel at 8 a.m. in the morning. So that's open now to every GP practice in England. From October, you can access that to then say, can I please have an appointment for this and this, and then they will triage it. What we haven't necessarily solved is, does everyone get an appointment quickly and conveniently? But that sort of reduction in the scrum of 8 o'clock in the morning has been taken away. What's coming in April from GP services, from the 1st of April with the new contract, is that they are asked to reserve specific appointments for people who are or believe themselves to be in need of urgent care that day, so that people can get access that same day and not be put off by issues of access that we've traditionally seen around restricted phone lines and others. And last year, nationally put about £1 billion into the GP contract to grow that capacity to allow them to deal with it. And there's another £500 million going into GP services from April to support that, because one of the key issues that is undermining confidence in the NHS is access to a GP. That politically and locally we are very aware of. So part of our plan is very much, can we measurably improve the experience of access for residents? Can we make sure that we are getting rid of that 8 a.m. scrum, if I call it that, and making sure that that's available, and hopefully not asking people to come for appointments for blood tests that it's a waste of everyone's time as part of that. So something very much we will be measuring with each of our practices to say, actually, is access getting better? Is the experience of access getting better? Do we think those outcomes are better?
You say the contract changed in October last year. I've never seen anything that in the public domain that says it's changed. So the public still aren't probably aware of it. I think something needs to be done to actually promote that. And maybe some of the surgeries need to be promoting it too. But I have never seen anything to that effect.
And which practice were you referring to, just out of interest? Thank you.
Councillor Barber.
Thank you, Chair. You're calling this a partnership. I need to ask you a specific question about a specific person. This lady is currently in North Cambs Hospital, has been there.
Sorry, can I stop you, Councillor Barber? Can we not refer to individual questions at this stage, rather keep it on a general basis?
Okay, so generally, if a person went from one hospital to another hospital, where they had an appointment, from being residing in a hospital to an appointment at a different hospital, should they be allowed whilst waiting for their return of 5 hours, should they be allowed in the second hospital to have insulin or painkillers if needed?
It would depend on the clinical circumstances. It's really difficult, and I'm not qualified to give you an answer on that one. It depends. I'm not medically qualified, but I'm very happy to look at the individual case if you want to pick it up with me, and we can take it outside of the committee.
So also, in with that question, if a person went to a hospital with a dressing already on a wound, to have the wound photographed, should there be a facility to have a clean dressing put back on the wound after the photography?
Well, we'd very much hope so, but it would depend on the wound. In some cases, it would require specialist attention. So some of the wounds require some of our specialist services, of which we have specialist wound services for the packing of the wound and so on. So it does depend on the wound itself, and in some cases, depending on if they've had a surgical procedure, who needs to do that and look after it. I would hope in most cases we'd be able to redress it.
Thank you. Councillor Roy.
Thank you, Chair. I'd like to go back to follow on from Councillor Scanlon's point that the GP contract changed in October 25. And I'll refer back to the last time you were here when we talked about communication between GP surgeries and their residents. Here we are again at this ONS meeting asking the same question, that certainly the surgeries in my wards know nothing about this 24 hours a day available appointments. It's not been communicated, residents don't know about it, and really I'm getting concerned that here at the ONS we're putting information over which is critical to the health and well-being of residents, but we're not actually seeing anything coming through, and I just wonder if you'd sort of clarify that for me.
Yes, so I would have expected that GP practice would have made their patients aware of the changes in their system. I'm very happy to have a look at that and see where that's not been the case, and to have a look at the point you raised about how well advertised has that been, and then because it's a national standard, it's been nationally funded, the expectation is there, so we need to make sure that that's being delivered locally to residents. If it's not the case, then we need to do something about it. So I'm very happy to look into that.
Yeah, I think certainly in Whittlesea, and certainly where my wards are, it's almost a daily occurrence when people say, "Oh, well, I couldn't get an appointment. They've told me to ring back tomorrow." But there's no sort of follow-on to say, "Oh, I've been offered an appointment." That very rarely will I hear that, and I think if other councillors were to approach their surgeries, it would be very much the same thing. So there's obviously a broken link somewhere there. It may be that, and I'm not saying this is what happens, that surgeries choose not to release that information, or the staff are not aware, so we don't know what that is, but certainly I think that's something you need to take back. If I may, Chair, just follow on from that question, I want to just touch on the All Right Mate initiative that was launched, working really, really well, and they're doing great work with that. And I'm also pleased to see that we're now getting vaccinations coming into the communities, that we're running some of those. But I wanted to just take that a step back, because health should be about prevention. And I don't know if there's work being done at college level and sixth form level with students to disseminate information about health and well-being and mental health and those kind of things, and whether that's part of your remit, and whether we should be doing more of that, so that we don't have masses of numbers that are coming into the partnership, with ailments that we're trying to then treat, which could have been prevented.
Yeah, thank you. Just on the access to a GP, so while some of the systems have changed, we haven't necessarily resolved all the issues about demand capacity mismatches. So there is still more demand than capacity, we would say, for primary care services generally. We have not resolved that. We've nationally tried to change some of the access points to make it better and more even for people accessing it. So I'm not going to sit here today and say we've solved all the access issues, because we certainly have not. And that's more what we have to do. Just thank you for comments about All Right Mate. I think it's a really good initiative, and we hope to spread it and do more of that. And in relation to young people, young with the quite quite so there's definitely do exist in terms of briefing and time set aside for health and care professionals to brief people about healthy choices. They do exist. I think we could do more. There is a national drive to do more access to mental health services in each and every school as part of the national plan, the national 10-year plan. We want to see that rolled out. Our mental health trust and CPFT, as part of our partnership, will be leading on that to make that provision consistent and available in those schools to support people with an array of different mental health issues. So I hope that's more systematic. Again, it's not a panacea for solving all our issues about demand and capacity for mental health services, but particularly for younger people, that focus is definitely there.
Thank you, Chair.
Councillor Hay.
I just wanted to say something here. I know on my surgery's website, if you go on there, it tells you can download the NHS app, which allows you to book appointments. It allows you to view your medical record, all sorts of things. So I would have a look at your local surgery website and see if it tells you about it.
Thank you. Well, there are no further speakers. Therefore, I would like to thank you for your attendance and for the information that you've supplied us today. Thank you for attending. We will now move back to agenda item number 6. Item 6 is an update from the Road Safety Partnership. I would like to welcome and invite those attending for the presentation of this item to join us. Thank you for joining us today. Please can I ask that each of you introduce yourselves by name for the purpose of the recording and give a brief overview of your role in relation to this matter.
Good morning, Chair. Simon Bergin, Road Safety Manager, Cambridgeshire County Council.
Dan Horn, Felon District Council, but here on behalf of the Community Safety Partnership. Councillor Warwork is en route.
Thank you. Please go ahead with your presentation.
Thank you, Chair. I provided a report prior to attending the meeting. I'm just going to summarise where we're at without going through too much detail. I've also been provided with a set of questions as well that have been put forward to me prior to meeting today. This update is in relation to the road safety duties from the Highway Authority and how we are currently managing the Road Safety Partnership, or Vision Zero as it's called in Cambridgeshire, using our network of people that work within the partnership and the wider community. The Vision Zero Partnership is hosted currently or chaired currently by the Police and Crime Commissioner, and I am the Deputy Chair of that meeting, which occurs quarterly. Within those quarterly meetings, there are reports from the workstream leaders groups. Those workstream lead groups have specific responsibilities for each facet of road safety, and we're also reporting from the Social Review Board, which is quarterly, where we review all of the safety provisions across the whole county with partners and provide feedback to the board on related factors and where our main issues of concern are. The 5 main areas that, 4 main areas that we work on within the board are safer speed and safer road users. That then comes down to enforcement with Cambridgeshire Constabulary and Police and Crime Commissioner. Safer vehicles, which is the fast service Cambridgeshire Fire Rescue. Safe roads and road signs ourselves as the Highway Authority as well as Peterborough City Council. Post collision response, which is the road victims trust handling and trauma network. Based on our responsibility. The partnership is committed to the safety of the approach That's the system that's adopted in the new highways, the new road safety strategy government published earlier, late last year, which basically says that you should consider defining a system that allows for drivers to make mistakes, reduce the risk of harm when that mistakes. That can be done through numerous means, through education, through training, through engineering, but that's the money behind it. So the system approach accepts that as drivers, people will make mistakes, or as road users, they will make mistakes, but it's how you mitigate that risk through various different measures. The Fatal Review Board, as I say, that meets quarterly. That's where we review in detail every single fatal road traffic collision that occurs on the highway network. It used to be that the Highway Authority would always review them. They had a duty to do so, but purely from an engineering basis, and partners in isolation, so the police and others would not would work in silo. So you wouldn't necessarily get the granular detail on any particular collision. So you weren't picking up what was really happening. So the Highway Authority would look at the scene to say, well, the road's okay, there's nothing we need to do here. Whereas now what we do is we look at all of the factors involved with the police and other partners, including National Highways and others, to understand the nuances around every single fatality. So is there criminality involved? What are the key trends? Are there things that we're starting to see as they develop through? Because obviously these are the ones that cause the serious harm and they have the biggest impact on communities. The Fatal Review, it focuses around our Highways Operational Standards Manual, so making sure that the road network itself meets the required standards at that time, and then also with the capital budget we have available, where there's any changes we could make to prevent risk of harm, and that can come around from very simple signage, lineage, to more high-level interventions such as junction realignment and changes to the highway network. Coupled with that, the police will also then look and review their activities in and around our priority routes. So what you may see is vehicles parked up on strategic routes at certain times of the year, because what we are able to do now is track more where our most common serious injury or fatalities are occurring on a monthly basis. So when officers have downtime, they will deploy that resource to that location just purely to sit. They can sit and work remotely, but having the vehicle on that route has been shown to actually reduce the possible risk of harm, because obviously drivers are seeing that as a positive deterrent to unlawful behaviour on the road. We carry out an awful lot of trend analysis. We're very fortunate in the county that we do have good data, not just from the traditional means of Statistics 19, which is the forms that the police complete for all of our injury collisions, but we now also have speed tracking data where we are able to look at individual roads, individual sections, 100 metres in length, and actually review speeds on a live basis. So we can actually review if we have particular concern at a location through, be that a local resident writes in, or a member from county council or whoever really, we can actually look at those in great detail now. So we can see not only do we have a speed issue, what is the 85th percentile speed, in other words, 85% of drivers, what are they typically driving at? Because we accept, we don't like them doing it, but we have to be realistic that 15% of drivers generally will be doing things they shouldn't, which is an industry standard, and it's accepted across the UK. It's a standard that we use because not everybody wishes to comply with the law and legislation. So we look at the 85th percentile speed range. Coupled with the speed data, we have G-force monitoring data. So if people are doing harsh braking, harsh acceleration, harsh steering, we're also monitoring that. We put that in line with our cluster site analysis. So where we have injury locations or injury collision locations over a 3-year period, we look at all of that data, and it gives us a really good, rich picture of what drivers are actually doing there. So is it a speed matter? Is it failing to see? Is it braking late? Is it harsh steering at roundabouts, etc., that's causing loss of control? So we're very fortunate to have that kind of data. The overall trends at the moment for collisions is still downward. We are still seeing a downward trend and tracking close to our target, albeit those targets will now move because obviously the new road safety strategy that the government published has now increased those targets further. So we were looking at a 50% reduction. The government want a 65% reduction. A great deal of the road safety paper at the moment is open to consultation as to how best we think, as well as partners think, we can deliver on that and what's required to do it. It's one thing having the aspiration, obviously, it's another thing to actually be able to deliver it. So whether that's going to come with specific targets and who's going to hold the responsibility for those targets is unclear at this time. Will it be a policing target? Will it be a highways authority target? Will it be a partnership target? Bear in mind the partnership isn't a legal entity, so we're not quite sure where that's going to sit yet, but that's further work that is going to come forward in the next few months and we'll be paying very close attention to. The outstanding thing, unfortunately, from last year is motorcycle casualties are up. We doubled our fatalities last year. A lot of that, unfortunately, is down to criminality and criminal use of motorcycles by certain individuals. So, you know, a regretful loss of life. But the underlying trend there is that a lot of that did involve criminality. People that really disqualified using drink or drugs, the motorcycle might have been stolen, etc. So we have seen that increase. The fatal 5 factors behind a large proportion of most of our collisions are distracted or fail to observe. Drink and drug driving. Drug driving in particular is a problem. More and more people are finding themselves being arrested post collision or being discovered later in a fatality as having drugs in their system and therefore not in a position they should have been driving. Mobile phones, despite vehicle connectivity and what have you, mobile phones are still a problem because drivers are distracted when they're driving using phones, even hands-free. Excessive speed, 40% of our fatalities normally have an element of speed in them. That's either exceeding the speed limit or too fast for the circumstances, and two very different things there. And failing to wear a seatbelt is another. 20% of fatalities involve someone that hasn't put their seatbelt on. That's either passenger or driver. Patterns within the collisions, as I say, they're the main things that we've identified. So each of the categories that are contained within the graph show roughly where those are over the period. But certainly distraction and what have you is a you know and general driver behaviour and experience is another big one. Moving down to in particular severity by road speed limit. This is something we're really keen to keep an eye on at the moment, because what we are starting to see is that looking at what National Highways are doing on some of their trunk road network, they are looking at reducing speeds from national 60 down to 50 with camera enforcement. They've done it for the A47 from Peterborough to Norfolk. They've also successfully completed that in Bedfordshire and Essex. And they're already seeing some massive drops in the numbers of people getting involved in serious or fatal collisions on those network. And it's something that we will be keeping a very close eye on as a highway authority, because it may be we look to introduce that on some of our faster roads, particularly A141, A142 and the A10, where we have had a significant number of fatalities over the years that ordinarily involve overtaking where it's gone wrong, and of course the high speeds involved lead to fatalities. Particular risk categories: young drivers. Unfortunately, if you're a male aged between 17 and 24, you're more likely to be involved in a serious injury or fatal collision. And then we follow that trend in Cambridgeshire along with most of the UK. It's a very tough group to reach in terms of education and impact through social media and what have you. Because this group already tend to be quite high risk takers and you know at that age feel a bit invincible possibly, and therefore we are working with First Car. We've got a parent and young new driver webinar which is free that we deliver twice a year, but the uptake is very low. These people don't associate risk with their driving, despite the fact that the statistics tell us otherwise. So it is a difficult group to reach. We're also currently piloting the casualty reduction officer from the police. PC Boddington is going into our sixth form colleges delivering there a particular package of measures. So hopefully that's going to reap some rewards for us. But again, it's the challenge there is actually having the curriculum time and getting into the sixth forms to actually be able to deliver that. So that's kind of where we are at the moment with that. But it's a key area for us. But it's, as I say, it's tackling and engagement, and that's something because as the partnership we work with our wider area as well: Norfolk, Suffolk, Bedfordshire and Hertfordshire, Essex. And it's one of those things that often, as road safety professionals, it's that contact we struggle with. It's difficult. It's difficult to get our young drivers to engage. As I say, motorcyclists at the moment, last year was a particularly bad year, but some of that has come down to criminality, unfortunately. People taking high risk with riding motorcycles. The police bike safe scheme and fire service biker down scheme are still very well supported, and in fact oversubscribed most of the time. They're very, very popular. They're national initiatives, not just in Cambridgeshire. Cycling pedestrian collisions, obviously with our aspiration for more and more active travel, our cycle and pedestrian collisions in particular we keep a very close eye on. What we don't know is, it's kind of the iceberg mentality, if you like, or analogy. We don't truly know what our slight injury figures are involving cyclists and pedestrians on our shared use network away from the road network, because ordinarily the police don't get called to that. This is something that we're working on with the trauma network. There's a new initiative called Prana, which has been introduced by the National Health Service, as well as working with public health, to try and understand the data that we don't capture through traditional road safety data. So where we don't get a report of a collision involving an injury, it doesn't feature in the statistics. We know fully where it's going on because we know the numbers, or we have an idea, an estimate of the numbers that are going through A&E or GP surgeries. And of course, not everybody wishes to report a slight injury collision if they put their car in a ditch and they're either over the prescribed limit, or they've got no insurance, or stolen vehicles. So it's something we're going to bring. We're going to understand a lot more about. That is it's a national project. It features in the National Road Safety Strategy. So it's something that we will get some more and better data on, because it is one of those that we know is happening. We just don't know the total levels of what's happening out there. And of course, with the introduction and growing trend of e-bikes, cargo bikes and the like, which we are actively encouraging for people to move around. It's very efficient, it's a very green way of moving around, but there are obviously issues around how those cyclists, particularly the cargo bikes and things, are using our shared use network across the county, because they're bigger, they're faster, and therefore that comes with risk. And of course, it's not a traditional place you'd find activity from the police, etc., if it's unlawful. So we are, again, something that we're focused on. And interestingly, the road safety strategy nationally has picked up on and raised the question: how do you harness micro-mobility? The number of e-scooters that are on the roads that are illegal, for instance. So e-scooters, to be clear, they're illegal. They shouldn't be on a road. They shouldn't be anywhere near a public place. They shouldn't be on a path. They shouldn't be in a car park. They shouldn't be anywhere. They are illegal per se. But there are a number of people that are using them as a cheap and efficient way of moving around. So there is a kind of a trade-off there to be looked at, and how we're going to integrate that into a system that's not designed for it, we're not quite sure, but it would appear that there is support nationally for reviewing how we harness micromobility into our moving around, because these things, with the advent of better batteries and what have you, are being used a lot more by individuals, and not for unlawful purposes. There are professional people that use one of these things. They will drive to a public car park on the outside of the city. They'll jump on their e-scooter and go to work. It's something that we've got to look at. It's illegal, but it's something we've got to be prepared for, and we'll be working with nationally to see how that comes forward, and what measures are going to be looked at to try and make them safer. Because at the moment, there's no control over wearing PPE, protective equipment, helmets, gloves, or whatever. So, and we know through the trauma network, they get very significant numbers of people coming in with very significant facial injuries, broken eye sockets, and all sorts of things from people riding scooters. Current activities with regards to what we're actually doing out on the network. As I say, we have a capital fund. We have £600,000 a year set aside for road safety capital activity, which is to do with our various schemes focused around the cluster site analysis. And again, using that new speed data, which we only got available to us in November, we'll be looking at those and looking at how we're going to bring those forward. And obviously paying close attention to what we're doing with our 20 mile an hour speed limit initiatives, because that is something that we do support on. We are the two main strands of the 20 limit is obviously where we have speed data now, which we can look at to see what drivers are actually doing in an environment. Are they travelling at or near to 20 miles an hour? In which case, a 20 mile an hour scheme fits, because it's very straightforward. It's just a matter of changing the speed limit for the road and changing the signage. There are other places where you may find that the speed compliance gap is too big, So, for instance, as we go in and look at a speed limit of, let's just say, it's a 30-mile-an-hour speed limit, and you've got 85% of drivers are travelling at 36 or 37 and 30, that tells you, obviously, one, you've got a speed problem, but it's a big gap to get them down to 20. So how are you going to do that, and what means would you do that by? And that may mean design and what have you. So actually changing the layout, adding raised cushions, etc., to force people to slow down. But it's very clear that the reduction in harm from introduction of 20 speed limits is working. Certainly seen in Wales, certainly seen in some of the London boroughs, where the reduction in the number of people getting injured or both serious and fatalities actually has come down a lot. Already mentioned that one. That's the site we've already done. Sorry, I've jumped about a little bit, but I'm getting through it. We're still carrying out a road safety audit function, so where we have major developments and people accessing the network, we will do the safety reviews to make sure whatever it is the developers wish to bring, they will do it within the realms of the road safety audit team, making sure that the junctions design meet the needs of not only what the books say effectively, what the design should look like, but also what the needs are of the local community as well, and where possibly encouraging integration with active travel, etc. Fixed camera activity around the county. We still have our active camera systems. They are all currently live and working, and we are looking at how we review the 20 schemes, because where we introduce a 20, we currently have a fixed camera site. Unfortunately, our cameras are too old and don't meet the type of approval. That's a legal definition. They do not meet the type of approval to be used in a 20 limit. It's not a matter of just turning them down or us making a choice. They don't meet the standard. So where we do introduce 20 limits, unfortunately, those cameras will become redundant. So we will be looking to relocate them to other locations. And that will be done on a heat map basis as to where they'll best be used. Average speed sets, as we know, certainly in the Fenland area, are active and working and do their job on a daily basis. So there are no issues with those at the moment. The road safety education team are still delivering the youth travel ambassador scheme, as well as the junior travel ambassador scheme, working with primary schools and secondaries across the whole of the county. We don't service all of them. We can't. We only have one individual that does that, so we don't have full coverage as much as we might like. And we also obviously carry out all of our school crossing patrol reviews, as well as safe routes to school on a regular basis. So when a school raises a concern, the safety team go in just to carry out a review of what's happening outside that school, and if there's any measures we could consider or bring. But the primary function now is that we are really trying to push alternative methods of people getting to school rather than just driving all the time. If they can walk or find somewhere safe to park away from the venue, then that's what we're trying to work to by using things like pub car parks, supermarket car parks, etc., to enable people to walk or cycle rather than take the car, because as we know, around our schools in the mornings it gets very congested. There we are, very quick and brisk, sorry. Bang.
Thank you very much for the presentation. Before I open the item for discussion, can I welcome Councillor Warwick to the meeting and ask if you could introduce yourself to assist with recording the minutes.
Thank you, and I do apologise. I'm Councillor Susan Warwick. My portfolio, this comes under my portfolio, so I do apologise I was late today, and thank you so much for moving the agenda around for me. It was muchly appreciated. Thank you.
If you could just state your name for the recording, please.
My apologies, I thought I did. So Councillor Susan Warwick, not a problem.
You may well have done.
Yeah.
Thank you. I will now open this item for discussion. Are there any questions or comments? And I know there are. I have a list already. I'll start off with Councillor Miscandlin, please.
Thank you very much for your presentation. You're actually talking to the already on board with this. I taught motorcycle training for 34 years, so road safety is at the heart of what I do. Going back to when I was at school, taught cycle proficiency, which very few people here will remember. Every year, my car has to be MOT'd. The roads don't. The roads are in an appalling condition, the worst I've known in Finland for 40 years. You say motorcycles, injuries and deaths have gone up. That's very, very unfortunate. But a lot of it is down to the appalling condition of the roads. I've actually stood in a crack in the road, whereas a motorcyclist that had gone into it, forget it. It's another one for the statistics. What are the Road Safety Partnership doing about trying to correct that and get something done to improve our roads? Where I live on the 605, we had 4 deaths in a year, not all attributed to the road conditions, but it certainly didn't help. And that road is still in an absolutely appalling condition. Even driving down there at it's temporarily imposed 50 mile an hour is still unacceptable.
For the Road Safety Partnership point of view, this is where we carry out the scene visits with the police, and where the information and the suggestion is that this may have something to do with the road surface or otherwise, then we will bring about a change either through improvement to the surface, or invariably, particularly with some of the fen roads, because of the soil affected roads that we have where you've got the big undulations, we would look to introduce a speed reduction. So I can give you an example of that. Bates Road, 1101 at Littleport, we've reduced the speed limit there to 50 miles an hour. So that was a motorcycle fatality that unfortunately lost control of the machine, having hit such an undulation. In terms of, because the police obviously test the road, they're allowed to do that at various speeds. They have the authority to do it. That particular case was that the rider unfortunately was travelling way in excess of the speed limit, and what they were saying to us is, however, it does unsettle a motorcycle at speed, and therefore you can, our advice would be you look at doing something either to improve it or change the speed limit and reduce the harm that way. So that's what we would do. That's the input that we have for something like that. So where we have a fatality or significant serious injury and potential loss of life, then we would review it and make changes.
That's most welcome, but it isn't always the answer. Being a motorcyclist, and I'm still a motorcyclist, I've been motorcycling for well over 70 years. So I do know about motorcycles' instability on roads, and it's the road conditions. And it's all very well saying, well, we'll reduce it to 50 mile an hour, which is what Long Gravel's got a temporary speed limit on it at the moment. Whether that's going to become permanent or not, I don't know. And nobody knows at the moment. But it's not the motorcyclist's fault. It's the fault of the lack of investment in the roads in Fenland. It's not just the A605, the B1098. There was a dip in the road of 400 millimetres, and it took a visit from your highways officer with a county councillor to come down, and her words were, "I've never seen a road in such appalling condition." Well, get off your desk, come out and actually do a visit. Don't do a desktop survey because they don't work.
No, thank you. As I say, all I can say is that the highways teams, I just encourage everybody just to report, and keep reporting it. That's all I can say is keep reporting it. I didn't come across on my motorcycle today. I was hoping to, but didn't, because some of the roads I knew I'd be travelling on, I didn't fancy it. I was a police motorcyclist for 22 years, so I'm well aware. I'm well aware of the risks, and unfortunately, and yeah, you're quite right. But all I can say is to encourage all of your parishioners report.
Thank you, Councillor Hicks.
Yeah, I'd like to ask 3 questions if I may. I'll be quick. One of them directly regards to motorcycles. I haven't been a motorcyclist myself, and coming off at speed, hitting a pole with a blowout on the front wheel came off, so I chose to get rid of my bike. But the first question is regarding motorcycles. The mobile speed cameras, you've had access to this question already, hopefully. Yes. This is one of my, regarding speed cameras, mobile and static ones, that they always seem to be half of them around the wrong way, because when you're a motorcyclist, if there's a forward-facing one, you've got no number plate on your front, so you can just open it out and go. And the same with the mobile cameras, where the vans are always around the wrong way. They're coming towards you. So why don't they put them the opposite way around? You're going to say you need a photograph of somebody driving or something. Is that the answer? So you're never going to catch motorcyclists.
Correct. So the way the system works is that it's best evidence. If you consider that the number of motorcyclists on the road even now it's come down. It used to be 2% of the road population. It's now 1% of the road population. So if you look at it in terms of scale, you're going to focus your efforts on those people that are more likely to do that. So they are forward facing for that very reason. You take a picture of the vehicle, the number plate, and the person driving. So when the police go and visit that person or get the contact, and the person comes back with, I don't think I was driving, it's like, well, who's that? You know, it's job done. The trouble is with motorcyclists, unfortunately, some of those that are using them, that we have, and you can. I don't encourage people to do it, but you can go online, you can buy a kit that folds your number plate up. So you ride, you've got a safety camera coming up, you just flip your number plate, it's gone, and that's the reality. And the camera vans do have the ability to capture, so they are mobile vans, can capture and do capture, but again, they will capture oncoming for the speed, and then they'll take the picture as it goes past. So mobile vans do that. Yeah, there is. Yeah, there's a side facing camera. Basically, it does both.
3.20 of the report, this is also, you've had access to this question hopefully as well, refers to traffic collisions. Basically, it says that as soon as somebody gets killed, we go and investigate the roads. And why is there not a process where you can be proactive rather than reactive towards something? Because it seems silly that somebody has to get killed before we'd have to do something about it, basically.
Yeah, no. So you're quite right. So the fatal review is an entirely separate process. We carry out yearly cluster site analysis, yearly. So what that is where we look at our collision hotspots. Where are people crashing, and then we dive in there to understand why, and then what changes we can bring to the network to change it. So pick a junction on the A1, for instance, A141. If we had a cluster of collisions there that hadn't been there before, we would suddenly be saying, hang on a minute, why is this one suddenly come up out of the blue? And when we would go in with the road engineers, and we'd look at it and say, what's happened, what's gone wrong? Is it failure of infrastructure? The lines disappeared, the signage isn't right, something has changed materially in terms of flow, and this is all the data we have. We can see what has the flow increased, decreased, because of course if you decrease flow, that potentially can increase speed. If you increase flow, that can decrease the speed, but then people get impatient and their behaviour changes. So it's all about understanding all of that, but it's done by cluster site analysis. We don't wait for somebody to die before we do anything more.
Incidents. You said that e-scooters are illegal. Yeah, if you go to Cambridge, you can Vios, the electric scooters you hire.
You can, yes. It's part of the legal scheme. Yeah.
Right. So if you've got a legally, because it's under so many wattage, things like that, so much speed, less than 15 miles an hour.
Yeah.
So not all e-scooters are illegal.
Right, so scheme scooters, which are the Voice scheme, which is the one in Cambridge City, one in Peterborough City, you can sign up to that.
Yeah.
But the only way you can sign up to that is if you have a driving licence. So that sets your minimum age for a start.
Right.
They are speed restricted. So once they enter the city centres, they are ring fenced on GPS. So the scooters automatically slow down to 5 miles an hour once you get into the city centre.
Right.
So again, you're reducing risk of harm. So that's why they are legal and legitimate, and you can use them. And they are I have to say, they are very, very well used.
Yeah.
Very well used.
Just wondered why there was.
Yeah.
Thank you, Councillor Hay.
Thank you, Chair. My question is probably more for the portfolio holder. When I first saw this report, I thought, what's it doing coming to FDC ONS? And the reason I thought that is nowhere is it asking us for a recommendation, not even to note. On the first page in background, it mentions the Highway Authority in relation to, and then goes on to say the council must, as a relevant local authority, it doesn't make clear that it's not FDC council. And I think a lot of people reading this will assume, because it's before us, they're talking about FDC. Later on, it mentions that the council also works for schools. Again, that's not FDC. And in 312, it mentions this committee will be presented with data from the A47 project post-implementation, with a view to considering similar projects for the A10, A141. At that stage, it was obvious to me that this report was written for the Transport Committee at County Council, and nowhere in the background does it lay that out clear. And I just worry that ordinary members of the public reading this, already they come to us as FDC councillors with traffic problems, when really they should be going to the county councillor. And I just think we're blurring the edges here. If this needed to come before an ONS, I would have thought the best place would have been the combined authority, because they work closely with county council on highways and transport. We don't.
No, thank you for that. And I completely agree. We've already taken enough responsibility. We don't need to take responsibility for things that aren't responsible for. This comes under, I think we've done this because it comes through CSP. So obviously we use our partner agencies to filter down information on a ground level, and then use whatever knowledge we have in order to make sure that we feed back to the police so they can make the best decisions. But I couldn't agree more, and we probably need to make that clearer going forward. Thank you.
Councillor Murphy.
Thanks very much. When you started to talk, you talked about signage. Well, do you actually now leave the things when they get hit? Because there's poles all over the place with no signs on around here. You can go round a roundabout and you can see the lorries. They're looking to see where to go because they're down on the ground. And is it too expensive to replace them, or because it's beginning to look like fly tipping all the way around? I don't know whether it is where you are, but if you come around this area here, there's a lot of it. And all you see is poles here, poles there, and no signs on them at all.
So the highway network has an asset register. So every junction, every roundabout will have a list of what should be there. So the highways management officer, their job is to review their part of the network. They're supposed to go out, check that, and see what's missing. And when it's missing or it's not been replaced, then they basically order it and get it repaired. So again, if you've got things that are missing, all I can say is report it. Go onto the online system, report it, because they should be replaced. A lot of the time, some of this stuff, when it gets damaged, it can involve a collision, in which case they have an insurance detail. So it doesn't even cost us anything because it normally goes back to the insurance company to pay for it.
Some of these things have been there for 6 months and a year and have still not been replaced. Here's the second question, if you don't mind. And it might seem a silly question to ask you, but when these disabled wheelchair drivers, which you've got in every town, haven't you? They drive on the pavement. They also drive in the middle of the road. Is there a law which way they can do it, or can they drive anywhere?
They have access, basically. It's wherever they need to get to have access. It's to allow them to have access to various. But I mean, ideally, you'd prefer them if it's safe and it's wide enough for them to be on a pavement. But as we know, with some of our certain towns, villages, and things, the pavements aren't wide enough, and therefore it's safer for them to be on the road, because if they get too near to the edge, they can literally fall off. So they have access. There's no specific restrictions.
Well, you soon won't be able to put a sign up anyway, because they don't go any more than about 5 miles an hour. So you have to follow them down the road at 5 miles an hour. So you can't do anything about that.
Councillor Voice-Beard.
Thank you. Under paragraph 1.9, it refers to the Fatal Review Board making recommendations to the work stream. What usually happens when recommendations are given? Do they get actioned? Are they considered?
Yes, in simple terms, the workstream leads will sit round, look at the issues or the problem or the emerging trend, and then they will make a decision about what the plan is for dealing with that particular issue. So the last workstream leads meeting, as an example, unfortunately, it's our motorcycle statistics for last year, but we're taking that slightly wider, because it's not just ourselves in Cambridgeshire. Unfortunately, Norfolk and Suffolk have seen a similar trend. So we're working in a wider, because motorcyclists generally tend to go not A to B, but they go A to B to C and then back to A. So we're working in a wider remit about how we're going to carry out some active motorcycle activity, not just publication, not just online stuff, but also enforcement with the police. So getting them involved at a higher level to carry out activity days.
Thank you very much.
Are there any further questions? Councillor Barber, please.
Thank you. Just going back to signs, when the roads are closed, there seems to be a strange anomaly with signs. Sometimes it says road closed ahead, and the road isn't closed for about another 5 miles. So people aren't going up that road when they actually could go. Another thing is where there's a diversion For instance, in Wisbech, at the junction of Lethington Road and Dalgate Road, which is just two roads, there are 3 signs saying diversion, one pointing that way, one pointing that way, and one pointing straight up.
Yeah, what can I say? Some of the time, the closures are in actual fact not the highway authority. They're actually done by some of our. At the moment, there's an awful lot going on with Cadent Gas, what's it called? Active Fibre. So Cambridge Fibre Company are doing things. So we're not always in charge of the closures. Unfortunately, it's subcontractors that do that on their behalf. All I can say again is where you come across these issues and there are problems, please report them in. Please let us know, because they are under a duty to make sure they stick to the given diversion routes. If they want a road closure and they apply for it, they have a licence to do so, which they have to pay for. We tell them where they can go and what they must do. The reason for the advanced road closure warning signs is to prevent people getting too far into that journey when eventually that road will be closed. And that becomes a particular problem in Fenland, because as we know, some of our roads go that way and there's no other alternative because they're blocked by watercourse, etc. So often you will find it being closed, or road closed will say at that point, but obviously you've got properties, farms, businesses, industrial units, etc. that will still need access. So it's not actually closed completely, because there might not be an alternative for them to get round, which isn't miles. So you will possibly come across a road closed sign and think, well, where is it? And you'll keep going. You might not get to it. It could even be over the border in Norfolk, as an example. So sometimes you will come across them where they're very much preemptive to try and stop people getting stuck. But if you come across those situations where you've got diversions that don't make any sense, please report them in, because they have a duty and they can be fined accordingly if they've not got it right.
Can I just say, there is a sign now which says road close ahead at, and says the name of the road, and surely there could be more that put in like that.
Ordinarily, if we're doing it, that's what you'll find. But unfortunately, some of our subcontractors that deal with with gas, water, etc., and some of them are emergencies, so they might not have the sign made. So where we know we're going to be doing proactive work, so where we've got work going on coming up, where we know the road's going to be closed for a period of time to do complete resurfacing or whatever, you will find we will order that sign in, we'll have it printed, made, so it says we're closing it from here to here, and there you go. But of course, if it's an emergency, gas main's gone, water main's gone, it's just road closed and that's it. You won't get the information you need, unfortunately.
Councillor Miscandlin, like to come back in. I assume it's not an extension of your
No.
history of 70 years motorcycling.
No, it's not. It's furthering on from what Councillor Murphy has said. Roadside markings, that you've got these black posts with reflectors, so that you've got them all across the fens. Unfortunately, the contractors for flailing the grass verges smashed them down. They're never replaced. In fact, the ones around Gravel House Corner were reported last October. They still haven't been replaced. And all the way down the 605 to join the 141 and some down the 141, they're never replaced. Does the Road Safety Partnership get onto these people, because it's the contractors that are smashing them and not replacing them?
If it comes up as part of a fatal review, yes, because obviously we have the asset register, so we know what should be there. But obviously we don't go to we don't cover the whole county. But it is down to the highways management officers, the HMOs, that cover the whole of their ground to make sure these things are replaced. Again, all I can say is please report and keep reporting it. Keep going. Yeah, report it again. Keep doing it.
Councillor Carney.
Sorry, just to say that I need to leave the meeting now.
Oh, sorry. Thank you.
Okay, thank you.
Councillor Roy.
Yeah, just a quick mention, Chair. I just wanted to bring to your attention that the Speedwatch teams do an incredible amount of work across Fenland. In most villages, they provide an incredible amount of intelligence, as well as supporting the data for 20-mile zones, and it wasn't mentioned in your report. So I just wanted to make sure that they got an acknowledgement. Thank you.
Yeah, indeed, and they do come to the board meetings. They're in the fatal review boards as well, because they are a vital part of our community engagement as well as enforcement activity. It's just purely, this is quite a high level report. Not everybody's mentioned, but you're quite right. Invaluable service that they provide. Yeah, and it's one of those volunteer things that's it's a harsh volunteering environment actually. Yeah, thank you.
Well, there are no further speakers, therefore I'd like to thank you for your attendance and for the various information received. Thank you very much indeed.
Thank you.
We shall now proceed to agenda item 8. Item 8 is the panel's standing item in relation to the use of waivers, and I can confirm that there is nothing to report at this meeting. Agenda item number 9. The next item on the agenda is an update on previous actions, and you'll find this information on pages 67 to 68 of the pack. Is that duly noted? Thank you. Agenda item 10. Item 10 of the agenda is the Future Works programme, which is at pages 69 to 82 of the pack. The Future Works programme sets out the planned business for the panel for the forthcoming municipal year. Are there any questions or suggestions in relation to the Future Works programme? Everybody? Thank you. Agenda item 11. The final item of this agenda is to provide an opportunity to discuss any items which are considered urgent, and I can confirm that there are none. This marks the end of the meeting, and I declare the meeting closed. The next meeting of ONS is scheduled to take place on the 20th of April 2026 at 10 a.m. Thank you.